Good day, guys. I trust everyone is fine, and I'm very grateful for us meeting on our second presentation, and it's going to be on hypertension. But please, I always tell you I can't do that without you. So please, I want you to like and share. So please, subscribe to my YouTube channel at Dean360 Health TV. Please. So when we talk of hypertension, hypertension is defined as the persistent elevation of systolic arterial blood pressure above 140 millimeters of mercury or diastolic blood pressure above 90 millimeters of mercury. Let me take it again. Hypertension is defined as the persistent elevation of systolic arterial blood pressure above 140 millimeters of mercury or diastolic pressure above 90 millimeters of mercury. And when we say something is persistent, something that keeps on moving, something that keeps on repeating itself. And when we say something is elevated or elevation, something that keeps on increasing steadily, going up. And I made mention of systolic pressure and diastolic pressure. When we talk of systolic pressure is the greatest pressure that normally occurs in circulation when the ventricles is contracting. It's the greatest pressure that occurs in circulation when the ventricles is contracting, while the diastolic pressure is the least pressure that occurs in circulation when the ventricles is relaxing. And the reason why hypertension is normally called silent killer is someone can live with hypertension for so many years, 2 years, 3 years, 5 years, 10 years without showing any symptoms. Hence the name the silent killer, because you can live with it, not like the normal malaria condition that when you live with it you have this headache, you have nausea and vomiting and other symptoms. But with hypertension you can live with it for so many years without having any symptoms to complain about. Hence the name silent killer. So sometimes it is advisable for one to always check his BP, even every day or every week or every month. So now let's talk of the stages of hypertension. Basically, we have the 5 stages of hypertension. So we have the normal pressure, then we have the pre-hypertensive, then we have the stage 1, stage 2, then we have the hypertensive crisis. Let me take it again. We have the normal pressure, then we have the pre-hypertensive, then we have the stage 1, then we have stage 2, then we have the hypertensive crisis. But I would like to differentiate between all these stages based on the systolic and the diastolic values so that it will be much appreciated. So 1, with the normal stage, the systolic value of the normal stage record or reach 120 millimeters of mercury or less. That's when the systolic value record 120 millimeters of mercury or less, whilst the diastolic value of the normal stage or the normal pressure record 80 millimeters of mercury or less. So while this is 120 millimeters of mercury or less, this one is also 80 millimeters of mercury or less. Then with the pre-hypertensive stage, we have the systolic to record from a range of 120 to 129 millimeters of mercury, 120 to 129 millimeters of mercury, whilst the diastolic record 80 millimeters of mercury or less. So with the stage 1 hypertension, the systolic pressure normally record 130 millimeters of mercury to 139 millimeters of mercury, whilst the diastolic record 80 to 89 millimeters of mercury. Please take note of the values. With the stage 1, the systolic pressure record from 130 to 139 millimeters of mercury, whilst the diastolic record 80 to 89 millimeters of mercury. Then with the stage 2, the systolic pressure normally record 140 or higher. When it's record 140 or higher, and the diastolic record 90 millimeters of mercury or higher. whilst the diastolic record 90 millimeters of mercury or higher. So with the stage 2 hypertension, mostly that's where treatment normally take place. Treatment normally take place at stage 2 hypertension. So when your BP is checked, then the values based on the systolic and the diastolic is from 140 to 90 millimeters of mercury. When the systolic record 140 and the diastolic record 90 millimeters of mercury and above, mostly that's where the treatment normally starts. But sometimes it varies. So with the last stage, with the last stage, that's the or higher, is the most severe cases of hypertension. That's when it's recorded 160 or higher, while the diastolic record 120 or higher, 120 millimeters of mercury or higher. So looking at the first one, which is the normal pressure, which is 120 millimeters of mercury or less and 80 millimeters of mercury or less. So the BP must range within that. So anything beyond that can lead you to hypertension. So it starts with the pre-hypertension. From the normal pressure, it moves to the pre-hypertension. Then from the pre-hypertension, it moves to stage 1. From stage 1, it moves to stage 2. From stage 2, then it moves to the hypertensive crisis, which is the most severe cases. At this stage, it can lead to so many conditions such as stroke, because it can rupture the blood vessels which push blood to the brain. So now let's talk of the incidence of hypertension. It is believed that 50% of the whole world above 60 years are at risk of getting hypertension. 50% of the whole world above 60 years is at risk of getting hypertension. Whilst when we look at the gender, women are more prone to hypertension than men, but women can tolerate it better than men, because the reason why women can tolerate hypertension more than men is because they can easily adapt to the lifestyle modification. Because when one is diagnosed with hypertension, you can't live a normal life anymore. There are certain things they will tell you to stop, they will tell you to do this, they will tell you to do that. So women can tolerate such adaptation more, or the lifestyle modification. Women can adapt to that kind of lifestyle modification more than the men. So that's why women are, even though women are at risk, but they can tolerate it more. Types of hypertension. Basically, we have two types of hypertension. We have the primary hypertension, then we have the secondary hypertension, and we have other forms of hypertension or other types of hypertension. With the primary hypertension, the cause is unknown. There is no known cause for primary hypertension, but it has a possible risk factors. We can talk of one, the age of the individual. When someone is above 60 years of age, is at risk of getting hypertension. With the gender too, women are more at risk of getting hypertension more than men. Then we can also talk of obesity, and someone who normally smoking or smokers, then alcohol consumers, and stress is also a factor which can all lead you to primary hypertension. But with the secondary hypertension, it normally occurs when there is an underlying condition. When an individual is having an underlying condition, we can talk of someone with diabetes mellitus, someone with cardiac conditions or cardiovascular conditions. You can also talk of kidney diseases or someone with renal diseases. Even pregnancy can also lead you to secondary hypertension, because when someone is pregnant, due to the hormonal imbalance or the hormonal changes, it can lead you to secondary hypertensions. Then we can also talk of drugs. We have drugs such as amphetamine can also lead you to secondary hypertension. So we have these cardiovascular diseases, renal or kidney diseases. We have this diabetes mellitus. Then we have drugs and even pregnancy. All these can lead you to secondary hypertension. That one normally occurs when there is an underlying condition. Let's talk of the other forms of hypertension. With the other forms of hypertension, one, we have the isolated systolic hypertension. Isolated systolic hypertension. Then we have isolated diastolic hypertension. then we have pseudo hypertension, and we also have white coat hypertension. With the isolated systolic hypertension, the systolic value records from 140 millimeters of mercury or higher, whilst the diastolic remains the same, that's from 80 millimeters of mercury, or even sometimes it's less than the 80 millimeters of mercury. It's only that the systolic value that keeps on moving up, or that keeps on shooting from 140 millimeters of mercury or higher. But with the isolated diastolic pressure, the systolic pressure normally remains the same, or sometimes it's even less, whilst the diastolic pressure keeps on rising from 90 or higher. So the difference is with the isolated systolic pressure is the systolic pressure that keeps rising, but the diastolic pressure remains the same. And with the isolated diastolic pressure is the diastolic pressure that keeps on rising, but the systolic pressure remains the same. Then we have pseudo hypertension. Then we also have white coat hypertension. With the white coat hypertension, it normally occurs at the hospital setting. Even though the individual is normal, the BP is normal, but when you get to the hospital settings, because of the environment or the nature of the environment, his BP shoots up when the BP is being checked. But when the person is out of the hospital or is out of the hospital settings, the BP gets back to normal. Hence the name white coat hypertension. White coat hypertension. So with the other forms of hypertension, we have the isolated systolic hypertension, then we have the isolated diastolic hypertension, we have the pseudo hypertension, then we have the last one as the white coat hypertension. So now let's look at the clinical manifestations of hypertension or signs and symptoms of hypertension. Hypertension may be asymptomatic, thus one can live with hypertension for so many years without knowing he or she has hypertension. But in severe cases, one can exhibit headache, palpitations, dyspnea, that's difficulty in breathing, epistaxis, that's bleeding from the nose, there is chest pain, and we can also talk of activity intolerance. So when one shows all these signs and symptoms, please, you should get to realize that there is a condition that is occurring in your body which you have no idea. So you walk to the nearest health center, or if you have the BP apparatus, please check your BP and find out whether you have hypertension or not. But the most important case or the most important advice is to walk to the nearest hospital for medical attention. Let's talk of the diagnostic investigations or the possible tests that is done to rule out hypertension. So with hypertension, we can talk of history and physical examination. With the history and physical examination, that's where the doctor will ask you so many questions. He can ask you, is anyone in your family who is having hypertension? He can also ask you some of the signs and symptoms, whether you are experiencing them or not. Maybe he can ask if you have chest pain, you have palpitations, you have headache. Mostly such interaction normally occurs in the consulting room. And we can also talk of the electrolyte level, or you can also talk of the serum electrolyte level. With the serum electrolyte level, talks about the electrolyte. With the electrolyte, we can talk of the potassium, the chlorine, the sodium. So with the sodium, for instance, when one is having hypertension, mostly the sodium level is very high, while sodium is believed to retain fluid in the body. So when fluid is retained in the body, meaning the blood volume is going to increase. When blood volume is increased, definitely there's going to be an increase in cardiac output. When cardiac output is increased, definitely your BP is going to shoot up. And when potassium too is reduced in the body, there is a high possible of BP to rise up. Your BP can rise up when potassium level is very low. So when sodium is high, it leads to, when there is high level of sodium, it can lead to hypertension, and when there is a low level of potassium, it can also lead to hypertension. So now we can also talk of the lipid profile or serum lipid profile. This test is normally done to rule out the amount of lipid in the blood or the amount of cholesterol in the blood circulation. So The higher the lipid or the cholesterol in your blood, the higher the heart diseases or the blood vessel or the cardiovascular diseases. There is this condition known as this arteriosclerosis, and we have atherosclerosis. So when that happens, the heart finds it difficult to push blood through these blood vessels. So when that happens, the heart need to work harder. When it happens that way, cardiac input or cardiac output is increased. Cardiac output is normally increased, and cardiac output is the amount of blood that is ejected from the heart within a minute. So when cardiac output is increased, definitely the heart is going to pump harder for it to work very hard. So when that happens, you end up getting hypertension. And we can also talk of ECG. ECG is electrocardiogram, and it's also a device that is normally used to check the electrical activity of the heart. And that same ECG can also rule out the enlargement of the heart, whether the heart has grown bigger or is out of normal in terms of the size. So all these are possible tests that can be done or to do to rule out possible diagnosis of hypertension. Let's talk of the pharmacological aspect of hypertension or the treatment of hypertension. So the treatment of hypertension mostly are into classes. So we have one as the angiotensin converting enzyme. Angiotensin converting enzyme. An example is lisinopril. Then we have the angiotensin 2 receptor blocker. Angiotensin 2 receptor blocker. An example is losartan. We can also talk of the beta blockers. The beta blocker example is atenolol. They can also talk of the calcium channel blockers. Calcium channel blockers example is nifedipine. Then we can also talk of the thiazide diuretics. Example is the furosemide. Then we can also talk of the vasodilators. An example is hydralazine. So these are the classes of drugs mostly that are used in treatment of hypertension. So now let's talk of some of the lifestyle modification one is supposed to adapt when he or she is having hypertension, or even when you are not having hypertension, you can still adapt to that kind of lifestyle modifications in order to stay away from the condition known as the hypertension. So one need to ensure or to maintain a healthy weight. You need to maintain a healthy weight. Then two, you can also ensure to stay away from saturated fat. Avoid eating saturated fat or food high in fat. Then you can also ensure you exercise regularly. Then you need to also avoid alcohol consumption. And we can't talk of alcohol without living so you need to also stay away from smoking. Yes, you need to also stay away from smoking. And we can also talk of exercise as well. So you need to be active all the time and avoid sedentary lifestyle. That's from your room to your car to your office, from your office to your car to your room again. There is no exercise. So please, these are some of the things one can do, or these are some of the lifestyle modifications when one is having hypertension, or if you want to even stay away from hypertension, one can ensure that he is into this behavior or he is into this type of lifestyle modification, or he should try to adapt this kind of lifestyle so that he or she will stay away from hypertension. So thank you very much for being with me on my second presentation, and I'm very glad for us getting the chance to meet again. And our next presentation is going to be on hypotension. We just talk of hypertension. So the next presentation is going to be on hypotension. That's when you have a low blood pressure. Even that one is quite serious, or is much dangerous than the hypertension. So please stay with us and make sure you subscribe to my YouTube channel at Dean360 Health TV, and you can also like my page on Facebook, day 360. So please, 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 I can't do this alone. Please, let's do this together. Thank you very much. Thank you very much. Thank you very much.